Performing a static posture assessment is useful as a starting point to determine what needs to be addressed first. A posture assessment is important to look out for potential injury that may arise if they were to begin an exercise program and to help manage or address chronic musculoskeletal pain due to poor chronic posture. It also helps us design a corrective exercise program to address potential muscle imbalances that are identified from the assessment. To perform an accurate posture assessment, the use of a posture grid wall chart can be useful to help you spot postural deviations. However, if you do not have one, you can still ask your client to stand in front of a plain white wall with good lighting. Your client should wear fitted clothes if they are not comfortable to remove their outfit for an assessment. Your client must be barefooted, wearing shorts with sleeveless t-shirts. It is recommended to conduct posture screening in a private area away from the view of others. This is important to ensure that the client remains calm and at ease during the assessment, as anxiety may lead to compensatory postures that may compromise the accuracy of the evaluation. Creating a confidential and comfortable environment is crucial for an accurate and effective postural assessment. There are also apps which you can download onto your smartphone to assist with the assessments or equipment that are specifically designed for posture assessment. In this video, I'm going to demonstrate how a posture assessment is done. So before we begin, you have to make sure that your client or your subject is dressed appropriately for a more accurate assessment. We're going to start with the anterior plane. So you're going to get your subject or your client to stand comfortably. And so Sue, could you just stand relaxed and don't compensate, okay? So you're going to stand as if you stand how you stand every day. So you're going to start the anterior plane. To begin with, you want to assess a posture from the top to bottom. But before that, you want to draw an imaginary line that starts from the bottom, somewhere in between her feet, right? An imaginary line going all the way up. It's a plumb line. So that will help you see if she's having any posture deviation. Once that is done, we're going to start from the top bottom. So you're going to start to look at the eyes. Just continue looking straight, all right, Sue? So you're going to stare in the eyes and the nose, and you want to see if the nose is aligned to the sternum. If the nose is not, or the head is slightly bent, then you know that it could be muscle tension along the neck. But by observing Sue, her head looks pretty much aligned. Then you want to go down to her shoulders. So you want to look at her acromion. So you want to see if this tip here is higher than the other. So if you draw a line like a T, you may notice that Sue's is pretty much level. So she looks pretty level. Some people may have higher shoulders, may display right side higher or left side lower, but Sue is pretty balanced. And then you want to go down towards the elbow and look for the gap right here. So some people who bend sideways may tend to have more gap at this right when they bend to the side. This could indicate that they have tight QL. So Sue looks pretty even. And then we're going to go down and look at her knuckles and fingers. You want to know if she's also bending sideways by looking at this two-end tip of the finger and see if it's level. So if one hand is lower than the side, one side, then she might have tension along this area, but Sue here looks pretty even. And then you might want to also take a look at the knuckles. So people with rounded back may tend to display a more rounded shoulders, and the knuckles tends to move forward. For this case, Sue's knuckles seems to be quite even, and she doesn't display much rounded back or tight chest. And you slowly look down at the knees, and you want to see where the knees align. You look at the middle of the kneecap. So ideally, the kneecap should align to her second toe. So what you may see here is Sue, both left and right knee, has a mild internal rotation at the hip. So this could indicate maybe she has tighter adductors or weak glutes. So this is something that you might want to address. And then you look at the toes and see if she has any pronation on the foot. So in this area, Sue looks pretty all right. Okay, so this tells me that probably the glutes has more issue rather than the ankle. And to look out for pronation, other clues include bunions on the big toe. So I noticed based on this observation, there's a little bit more pronation on Sue's left foot compared to her right. So this is how you do an assessment for the anterior plane. So now we're going to observe her side view. Again, we're going to start from the top to the bottom. You want to draw an imaginary line from the bottom up, somewhere half an inch or 1 inch away from my ankle, you're going to draw an imaginary line, drawing all the way up, straight line. So when that is done, we're going to start to assess her head to her heels. So we're going to start with observing her cheekbone. So this is Sue's cheekbone. Ideally, you want the cheekbone to be aligned towards your collarbone. So from here, we can see that there's roughly half-inch forward head posture. So Sue may exhibit or display some mild forward head posture based on her assessment. And then you're going to look down and look at her hip bone. So if there's a sway back, you may notice that her shoulders and her hip bone may not be aligned. If there's a sway back, the shoulders may go further away from the hip bone, but Sue looks pretty much aligned from our observation right here. And then you're going to look down and look at her lumbar and see if there's any lordosis or kyphosis at the lower back. So if there's anterior pelvic tilt, means an excessive anterior pelvic tilt, she will display something like a duck stance like this. But what we can see from Sue here, she has some form of anterior pelvic tilt, some form of lordosis, but it's a little bit flat compared to what a normal neutral spine should be. And if you look down to her knees and see if it's aligned right in front to her hip, so from the bottom, what I can observe is Sue is pretty all right based on this observation of her sagittal plane. And you also want to observe on the mid-back if there's any kyphosis. So sometimes you may tend to look up and down and you want to look up again just to make sure you don't miss anything out. So there's one of the common posture that you want to look out for is the kyphosis at the thoracic area, which means it's a rounded back. So from what we can observe over here, Sue has a pretty good thoracic posture. So we're going to observe from the back. Same principle apply. You are going to draw an imaginary line starting somewhere in between their leg, in the middle, and draw a straight line up. And then you're going to observe if there's any deviation of posture. So we're going to start again from the head. You're going to look at both ears, the bottom, the lobe, and you want to see if it's balanced. If one side is tighter, it may bend sideways. So you want to observe that. But what you can see from Sue here, her head is pretty level. You're going to move down and you're going to see her shoulders again. There's an acromion again. So she looks level from the front and is confirmed that she's level from the back view. You're going to imagine looking at the spine to see if there's any scoliosis. Sometimes scoliosis may show some S shape or C shape, but from what we can just casually observe from Sue, her spine looks pretty straight. Next thing you want to observe is the shoulder blades, or you want to look out for the superior angle of scapula to see if there's any difference in height of the shoulder. So this matches, so we know that there's not much difference between her left and right shoulder in the sense of elevation. And also you want to see her scap and see if there's any protraction or retraction. So if there's protraction, there could be a sign of kyphosis. So for Sue's case, she didn't display any kyphosis from the sagittal plane, so you don't see any protraction on her scapula here. So here it looks pretty all right. Then you're going to go down and look at her fingers again. All right, fingers looks pretty even. And you may notice there's some little gap over here compared to this. So maybe there's a little side bend towards the left. Minor, not major, so something that we don't really want to be too concerned about. You're going to draw a straight line and down. So if she's leaning one side more to the other, you may notice if you draw a straight line, it may be not right in the middle here. So she might be putting more weight towards the left again. And you want to look at her knees right here. If she has any leg length discrepancy, if one leg is longer than the other, you may see that this line here may be off balance. And then finally, you want to look at her feet. So you want to see if there's any pronation. Sue looks pretty okay from this view. So this is how we do a posterior screen from the front, sagittal, and the posterior view. From what you discover here, you're able to move forward and come up with a plan to address those issues. Now I'm going to ask Sue to over-exaggerate a poor posture that is mostly seen for people with osteoporosis. Because the earlier video, Sue had quite a reasonably good posture. So I'm going to ask Sue to compensate and show you what someone with osteoporosis may look like. All right, so again, looking from the front, Sue is doing an exaggerated posture to show you an example of what someone with osteoporosis may look like if you when you perform a postural assessment. So from here, you might notice that Yeah, if she's bending more than one side, there's tension on the head right on the left, there's tension on the QL right here at the obliques, and you notice that when she rounds her back, her knuckles is more exposed and is rounded forward. And then she may be leaning more weight on one side. This is just an example of what a over-exaggerated person that you may come across who is having osteoporosis. All right, so just from looking at this, I think you can pretty much tell that there's something that you really need to address from this posture. So you're just going to stand straight a bit, okay? So some people may not be that exaggerated, maybe something like that, but these are the things that you may want to look out for. And now we're going to move to the sagittal plane. So Sue, I'm going to ask you to turn that side, and then you're going to just round your back forward. Good. All right, so if I do this, if you notice from the head towards the toe, same principle, looking from the top to bottom, you notice that her cheekbone and her collarbone is much further, so she has a more exaggerated forward head posture over here, and you notice that her shoulder is rounded forward. You can see more of the scapula over here, so that's a sign that she's having a kyphosis. So kyphosis is also a rounded upper back. So this is like this is like someone with poor posture, I call like a turtle back. And then if you slowly look down and you notice that her lumbar spine tends to be straighter, so there's more kyphosis and lack of lordosis. So this is often seen with someone who has osteoporosis. All right, so I'm going to turn your back. So again, you want to look for the key areas for someone who is osteoporotic, which is probably the shoulder height. One height is higher than the other, and most importantly is the shoulder blades. Someone who is protracted would show this style of shoulder blades where the rhomboids is being stretched out, whereas someone who is with a proper posture will be retracted, and someone who is not will have a protracted shoulder blades. And then you're going to look down and you're going to see the same thing and exhibit if there's any leg length discrepancy. But for this demo purposes, we're just going to evaluate the upper body side of someone who is typically osteoporotic.